Hello students, this is an important question on the appendix. The question reads like this: describe the appendix under following heads: introduction, features of the appendix, position, arterial supply, and lastly the applied importance. In introduction, you may write, to begin with the question, it is a tubular structure. Appendix is a tube, okay, narrow tube, okay, which looks like a worm, okay. Looks like, that's why it is called as vermiform appendix, okay. It looks like narrow worm like diverticula. It is actually a diverticula from the cecum, okay. And cecum, by this time you know, is a blunt pouch where the large intestine begins, okay. So it is attached to the posteromedial wall of the cecum, okay. So on the posterior aspect and more towards the medial side, this is the attachment of the appendix is there, which is a narrow worm-like tubular structure, okay. Now this cecum is about its attachment of the cecum on posteromedial wall of the cecum is 2.5 centimeter below the ileocecal junction, okay. That means if we see the posterior wall of the cecum itself, okay, if we see the posterior wall of the cecum, then we can see the opening of the ileum in the cecum and the appendix also into the cecum. Let us see this diagram. And in this diagram, the anterior wall of the cecum is removed. This is the cecum. This is the ascending colon. This is the ileum, which is going posterior to the cecum. And this is that tubular, narrow, diverticular structure called as the appendix, okay. So if you see here in the wall, posterior wall of the cecum, this is the opening of the ileum, and this is called as ileocecal opening, which is a horizontal slit here, okay. Now just about 2 to 2.5 centimeter below and medial to this ileocecal opening in the posterior wall of the cecum is another opening, smaller opening, okay, which is a vertical slit, okay. This is the opening of the appendix. That means these two tubes, they open onto the posterior wall of the cecum more onto the medial side, okay, more onto the medial side, okay. So what I was saying, that it is opening of the appendix in the cecum is 2.5 centimeter below the ileocecal junction or ileocecal opening. Right, then coming to the features of the appendix, okay. As I said, that appendix is a narrow tubular structure, okay. So what are its features? Now it is a worm-like tubular structure whose length varies from 1.5 centimeter to 22 centimeter. Lot of variation are there. It may be as small as this tubular structure as only with the 1.5 centimeter length, very small, to that very long, up to 22 centimeter long tubular structure. It is a diverticula coming out from the cecum. Now, but its average length is about 9 centimeter, okay. Its average length is about. Now let us see this diagram. This is the cecum. This dilated part is the cecum. This is the ileum, which will open on the posteromedial wall of the cecum, and then this is the ascending colon, okay. This part is the ascending colon, right. Now from this part you can see a tubular narrow structure coming out. This is the appendix. This is the appendix is here, and as I said that the average length of the appendix is about 9 centimeter, okay. It's about 9 centimeter. Now in this appendix at the base, or where it is attached to the cecum on its posterior wall, all three tinea of the colon, which is called as tinea coli. See this band of the horizontal, this vertical band of the muscle, okay, in the cecum and in the appendix. There are three, and if you trace this tinea coli, they will be starting from the base of the appendix. Okay, they all three tinea, they converge at the site of the attachment of the appendix in the cecum, on the cecum. So wherever is the appendicular attachment is there, okay, cecum in any position, ultimately this tinea, three tinea, they will go and end at the base of the appendix. So sometime for a surgeon who is not able to find the position of the appendix, he is not able to find the appendix in the right iliac fossa while he is doing surgery, he then follow this tinea coli and goes towards the medial side. Where this tinea coli will terminate, there will be the appendix. Okay, so they can find out the appendix. Sometimes it is real difficult to just trace the appendix or to find the appendix in the right iliac fossa. Now this is usually connected to ileum by a triangular peritoneal fold. This is the appendix, and this is usually connected with the terminal end of the ileum by a fold of the peritoneum. And this triangular fold, which I have drawn in green color, this triangular fold of peritoneum is called as mesoappendix or mesentery of the appendix. Okay, now this mesentery of the appendix gives passage to the appendicular artery. That means this appendicular artery and its branches, they pass through the two layers of the mesoappendix and supply the appendix. Okay, supply the appendix. Let us see the appendicular artery from where it is coming. This is the superior mesenteric artery. Superior mesenteric artery gives an artery called as the ileocecal artery. So this artery is the ileocecal artery, which divides into a superior division, and this one is an inferior division of the ileocecal artery. Now from this inferior division of the ileocecal artery, branches will come out and they will go to supply the cecum first. So this is the called as the anterior cecal branch of the inferior ileocecal division. And then one artery will go on to the posterior aspect of the cecum, and this is called as postrocecal. So these two arteries, they will supply the cecum. Okay, and then a artery will be given which will go and supply to the appendix, passing through this triangular fold of the peritoneum called as the mesoappendix, through which appendix is hanging, okay, and attached to the ileum. This branches then they will supply of the appendicular artery will supply to the appendix. Now this appendix, this is a narrow tubular branch here, which is I am just pointing. Now it has three parts. It shows the three part. Since it is a long narrow tubular structure, it has a base, it has a body, and it has a tip. Sorry. Base is attached to the cecum on its posteromedial surface. Body is between the base and the tip, and it is tubular, long and narrow. Okay, this lumen is extending right up to the tip. That is, since it is a tube, it has a lumen which extends right up to the tip. And what is tip? Tip is nothing but it is a blind end. Okay, it is a blind end. It may be pointed sometime or rounded. Tip is there. Okay. Now, sometimes the fecal matter from cecum may go into the lumen of the appendix. Okay, and since there is no further, opening or drainage, since it is a blind tube, it will store here and very easily get infected. Bacterial infection will soon follow, and that's why the appendix is very common. Okay, it is very common. Okay, let us go further. After these features of the appendix, okay, we come to the position of the appendix. The fourth point is the position of the appendix. And in the position of the appendix, where it is attached, where the base of the appendix is actually located on cecum, the base of the appendix is a fixed point. Okay, it is a fixed point, and as we have learned that this base or attachment of the appendix is on postomedial wall of the cecum, again the 2.5 centimeter below the ileocecal opening or junction, okay, below this ileocecal junction. However, the base, though it may be fixed, but then this is a free tube, okay, only attached with the meso appendix here, okay. So this tip of and the body of the appendix, its position is not fixed, it may present in any direction, okay, it may present. So the tip of the appendix may present in any direction, and some of the most common positions of the appendix are shown here. This is the ascending colon, the cecum is here, ileum is here, and this is the base of the appendix on postomedial aspect of the cecum where this appendix is attached, and then appendix may go in any direction, okay, and some of the common directions are shown here, okay. I will tell you that it is from the posterior aspect of its base, I mean say postomedial aspect of the cecum. After base, the appendix will run behind that of the ascending colon, behind the ascending colon or cecum, and this is the appendix is pointing towards the 12 o'clock position. Most of these positions are given the name in the form of the pointers of a clock, okay, so that you can easily remember it here. Now since here the pointer of the clock is pointing towards the upward, okay, and that is resembling to the 12 o'clock position, which is also called as retrocecal or retrocolic. Colic means ascending colon. So it is either behind the cecum if it is small, then if it is large it will go behind up to behind the ascending colon, okay. So this position 12 o'clock is called as retrocecal or retrocolic. Then the appendix may, after its origin from the base postomedial aspect, it will come out and it may pass in front of the ileum or it may go behind the ileum, and this are pointing towards the 12 o'clock, and this tip is going towards that of the spleen, pointing towards the positions of the spleen. So this condition sometimes is also called as the splenic position, and if it is long up to 22 centimeter, then it may go right up to the spleen, okay, which is present here. In the upper left quadrant. Now, so these two positions are called as pre-ileal or post-ileal. If it is going behind the ileum, then it is the post-ileal position, okay, post-ileal position. And if cecum is in the post-ileal position, one surgeon will have to just find it out, okay, because it is hidden behind the loops of the ileum. Now, then there is a position which is called as 3 o'clock position. See this position, and this position, the tip of the appendix, if it is long, may be lying onto the promontory of sacrum, okay, promontory of the sacrum, towards, not on promontory, towards the promontory of the sacrum by passing through the L of the sacrum. That means it is going towards the sacrum at 3 o'clock position, because the appendix and cecum, they are present in the right iliac fossa, into the right iliac fossa. And then this is the 4 o'clock position, and in the 4 o'clock position, the tip of the appendix is going inside the pelvic cavity. So it is called as the pelvic position, because here is the pelvic cavity. Then if it is directly going downward, okay, then this is the 6 o'clock position, which is called as midinguinal, because in this case the tip of the appendix is close to the midinguinal point or the subcecal. This may be also, if it is very small, then it may be called as the subcecal, okay, subcecal. And the last position which is common is 11 o'clock position, and this is the paracolic position. It will lie in paracolic gutter here, okay, and this position is called as paracolic position. So sometime the appendix, okay, to find the appendix in right iliac fossa during the surgery of the appendix becomes difficult, and this many positions should be kept in mind Okay, and second important thing which should be kept in mind is that one has to trace through the tinea coli. Okay, and that because the tinea coli, they take origin from the base of the appendix. Now let us come to the peritoneal relation of the appendix. Okay, appendix is a intraperitoneal structure. Sorry. Okay, it is totally covered by the peritoneum. Okay, so that's why it is called as intraperitoneal structure. Okay, and this means appendix is connected with the ileum through a fold of the peritoneum, as we have said that it is the mesoappendix. Okay, so meso, and we have also learned that within the mesoappendix runs the appendicular artery which supply to the appendix. Okay, so this is the peritoneal relation of the appendix, intraperitoneal. This is an intraperitoneal structure. Arterial supply of arteries, we have already learned. It is supplied by the articular branch. Okay, appendicular branch. See here. This is the same. This is the appendicular artery of the branch of the inferior division of the ileocolic. So this is that appendicular artery which supplies to the appendix after running through this triangular fold of peritoneum called as the mesoappendix, to mesoappendix, right? Okay. Venous drainage is by the name of this, by the vein which is the same named, that is the appendicular vein, which goes and drain ultimately into the superior mesenteric vein, into the superior. So this is the venous drainage. Okay, it is the venous drainage of the appendix. Let us come to the lymphatic drainage of the appendix. Okay, and the lymphatic drainage of the appendix, to begin with, is the appendicular nodes which are within the fold in the mesocolon, mesoappendix, and from here it will go to ultimately to ileocecal or ileocolic. Okay, ileocolic group of the lymph node. Okay, it will go to the ileocolic. Now, what is the applied importance of the appendix? Why it is important? Okay, not only surgically it is a most important organ, but it is also important, okay, anatomically. Okay, anatomy. Now, the appendicitis, it is important because frequently it shows the inflammation. Okay, there is infection of the appendix because there is a large collection of lymphoid tissue in the submucosa and mucosa of appendix. If you will learn the histology of the appendix, then there are many lymph nodules are present within that of the mucosa and then to the submucosa of the appendix wall. Okay, and why so many lymphocytic collection is there in the appendix? Because, as I said, that it is a blind narrow tube, so the fecal matter which may pass into the lumen of the appendix may remain there and get infected with the bacteria, and to fight with this bacteria so many lymphocytic collections are there. So because, as I said, it is a blind tube and the very common site of the infection. Okay, so the infection of appendix is, that's why called as appendicitis. It is called as appendicitis, and this condition is associated with the pain in the right iliac fossa, then in lower abdomen, and if it progresses, then there will be vomiting and fever will be there. Okay, it will be associated. And if it is there, infection is there, not controlled, conservative treatment by, then surgery becomes necessary. That means you will have to open the right iliac fossa, abdominal cavity, cut open the appendix, okay, and throw it. Okay, so that surgical removal of the appendix become necessary, and if it is infected, and this procedure of surgical removal is called as appendectomy. It is called as appendectomy. This complete a short answer, okay, on the appendix, okay, on to the appendix, including its applied importance. You can write this question by drawing 2 or 3 or 4 diagrams here. Okay, 3 or 4 diagrams, that will be sufficient. Okay, sufficient. Thank you very much for watching this short video.